Welcome to our presentation on Gardner syndrome. This genetic disorder is characterized by the presence of multiple polyps in the colon, along with various other symptoms. Let's explore its features, diagnosis, and management strategies. Gardner syndrome, also known as familial multiple polyposis, is a hereditary condition. It is linked to a mutation on chromosome 5. Understanding its genetic basis is crucial for diagnosis and management. Clinically, Gardner syndrome presents with colonic polyps, which have a high risk of becoming adenocarcinomas. Osteomas are common in the frontal bone, mandible, maxilla, and sphenoid bone, potentially causing facial deformities and reduced mouth opening. Radiological features of Gardner syndrome include unerupted supernumerary teeth in the jaws and osteomas of the mandible. These findings are key in the diagnostic process. Diagnosis of Gardner syndrome is supported by the presence of supernumerary teeth and osteomas in the jaws or other body parts. These indicators help differentiate it from other conditions. Management of Gardner syndrome involves prophylactic colectomy due to the high risk of malignancy. Jaw osteomas may be removed for cosmetic reasons, improving patient quality of life. Jaffe-Lichtenstein syndrome involves fibrous dysplasia with café au lait spots. It is mild, non-progressive, and occurs in about 50% of cases. These pigmented birthmarks are caused by melanocytes in the skin. This slide compares Jaffe-Lichtenstein, McCune-Albright, and Mazabrod syndromes. Each has distinct features, such as polyostotic fibrous dysplasia and café au lait spots, with varying endocrine and muscular manifestations. McCune-Albright syndrome, first described by Fuller Albright in 1937, is characterized by polyostotic fibrous dysplasia, precocious puberty, café au lait spots, and endocrine hyperactivity. This slide contrasts McCune-Albright syndrome with neurofibromatosis. Key differences include the crossing of the midline and border characteristics of café au lait spots, likened to the coasts of Maine and California. Mazabrod syndrome is a rare condition involving fibrous dysplasia and intramuscular myxoma. It poses a risk of sarcomatous transformation, especially in females, due to estrogen exposure and GS alpha gene mutation. This slide highlights the features of café au lait spots, Mazabrod syndrome, and associated malignancies. Understanding these connections aids in comprehensive diagnosis and management. The molecular basis of McCune-Albright syndrome involves a mutation in the GNAS gene, affecting embryonic stem cells. This leads to abnormal cell proliferation, impacting bones and endocrine organs. Radiographic features of McCune-Albright syndrome include the classic Shepherd's crook deformity and Rhine's sign. These distinctive patterns are crucial for accurate diagnosis and differentiation from other conditions.